Our immune system is always on the lookout for intruders, and it's also more than capable of getting rid of many pathogens by itself. But sometimes the immune system needs support through medications to completely get rid of the pathogen. And when it comes to viruses, we can help destroy them through medications called antivirals. When it comes to the immune system, many times it's able to spring right into action through the help of vaccines. And that's because vaccines are able to issue a warning to the immune system so it knows about the virus before it even infects us. Pretty cool, eh? We'll talk about how this works in some more detail in a little bit. So, in our final episode today, we'll discuss treatment and prevention methods for the two main characters we've been talking about for this whole series, HIV and the coronavirus. This series is concluding in June 2020. Some of the information presented in the series may very well change in the future, but so far, based on current information, we've covered a range of topics pertaining to the COVID 19 pandemic and HIV. This has all been setting up to this final episode on treatment and prevention. You guys have seen my face here quite a few times now, but I want to take an opportunity to thank those that made this entire series possible. A big thank you to the entire Cote Lab, including Dr. Hélène Cote, for their ideas, suggestions, and tremendous support for this project. In particular, this wouldn't be possible without the help of three individuals, Nicolas, Loic, and Nancy. There is so much work that goes into creating what you guys see, from the research for each topic to the animations, the script, and Nicolas, Loic, and Nancy work diligently each week to help prepare all of that. I would also like to thank the Center for Blood Research, who sponsored and promoted the series. And finally, I would like to thank you, the viewer, for tuning into each episode. The feedback has been very helpful these past few weeks, and your comments have been really encouraging. So thank you. Okay, let's get to the content. So far, we've talked about what happens when HIV infects the body, and specifically how it can attack our immune system. We've also talked about the different ways in which we can test for the presence of the virus in the body. And as we know, testing is very important to detect an infection. But why is that? This is because the earlier you start treatment, the better it works, because less HIV gets integrated into the genome. But what exactly is HIV treatment? After learning that someone is infected with HIV, they need to be put on a special class of antivirals called antiretroviral therapy, or ART for short. And what purpose does ART serve? For one, it helps keep the levels of HIV in the body relatively low. It reduces the number of HIV particles in our body over time, to the point where oftentimes we can't even detect whether someone has viral RNA or protein in the body. ART also helps with preventing the onset of AIDS. If you remember, AIDS is the point at which our immune system is so damaged it can no longer fight off intruders. With ART, viral levels are lowered, preventing the progression of an HIV infection to AIDS. And because we reduce the viral levels in the body through ART, we are also able to reduce the transmission of the virus, meaning less people can get infected from one person. I want to talk about that last bit on transmission a little more, which really shows how effective ART is in treating HIV. This is the concept of U equals U. Undetectable equals untransmittable. This means that if your HIV viral load is so low it can't be picked up through tests, you can't transmit the virus to anyone else. This is the virally suppressed in the last 90 of the 90-90-90 goal, if you remember from last episode. To put this into perspective, a mother who is taking ART to successfully treat HIV has an essentially 0% chance of transmitting the virus to her child during childbirth. And this is because having undetectable amounts of the virus in the body means there's too little of it to pass on to others. Let's actually see how ART works. It kind of acts as a roadblock for the virus. Let me show you what I mean by that. Here's a CD4 T cell, the immune cell HIV targets. So if you remember, once HIV makes its way inside the cell, it tries to convert its RNA into DNA through a protein called reverse transcriptase. So one type of antiretroviral can prevent reverse transcriptase from doing its job, so no viral DNA is made. It's hard for the virus to make more copies of itself if there's no viral DNA, right? And then another type of ART can prevent integrase from integrating the viral DNA in the DNA of the cell. And then another antiretroviral drug can prevent protease from packaging new viral proteins to make a new virus. There's a slight problem, however. You see, HIV also has a special ability to change very quickly. When it makes millions of copies of itself, lots of alterations in the virus are made, which means that over time, the virus changes from what it was originally. Because of this, certain ART drugs aren't able to stop the virus because they can't target those new proteins anymore. We can think of this as the virus bypassing the ART barrier. To overcome this problem, people living with HIV are often given a combination of ART, usually consisting of 3 or more drugs, and this is called combination antiretroviral therapy, or CART for short. With CART, we can stop the virus at multiple points in its journey to making more copies of itself, and in its effort to hijack the cell, even if the virus has changed some of its proteins. This means that even if the virus is able to overcome one barrier or another, it's very, very unlikely it'll be able to bypass the other checkpoints. But unfortunately, these drugs can't cure someone from HIV, and I mean that it doesn't totally get rid of the virus from the body. That's because there's usually a pool of infected CD4 T cells who lay low and avoid detection from the immune system and the effects of ART. And because of this, we can't really deal with them. At any time, these infected cells may activate to make new HIV particles. That's part of the reason why it's really important that those living with HIV take CART on a regular basis to make sure the virus doesn't increase in number over time. I just want to quickly connect this with our research. I mentioned this before, but we look at the health of the cells in those living with HIV and in children born to mothers who were infected by the virus as well. But a big part of our research is also looking at different combinations of ART and looking at the potential side effects of these drugs. Knowing this can shed light on which combinations work best for certain people and which ones can have some unintended negative effects. Let's talk about treatments for the coronavirus. Right now, there aren't any clear-cut antiviral drugs that can get rid of the virus from the body, but there are many, many drugs that are under investigation and are being tested to see if they are effective at fighting the virus and are safe to take. This is a virus that we haven't really encountered before, so we're in the phase of seeing where exactly we can target the virus and destroy it. Some drugs that are currently being tested are looking at the S protein, the docking protein we talked about in episode 2, to see if it's something we can target and prevent the virus from attaching to receptors in our organs. Let's look at vaccines now. When our immune system encounters an intruder, it tries to eliminate it, but it also initiates the training of specialized cells called lymphocytes, who launch a strategic response against the pathogen. These specialized cells also keep a memory of the pathogen. Keeping a memory allows the immune system to respond right away if this pathogen tries to infect the body again. Instead of taking multiple days or weeks to get trained, our immune system is activated right away, preventing us from getting sick again. But do we always have to get infected in order to develop a specialized defense against a pathogen? What if there was a way to train our immune system against a pathogen we haven't yet encountered? That's the goal of a vaccine. Vaccines are a way of training the immune system to prepare a strategic response against intruders we haven't yet encountered without making us sick. Some vaccines introduce a weaker version of the pathogen, some a dead version of it, and some only introduce fragments of the pathogen. These are then picked up by the immune system and kickstart the training process for the lymphocytes. Vaccines are like training exercises for our immune system, a bit like how we do fire drills so we know what to do in the case of a real fire. This is exactly what scientists are currently working on for the coronavirus. There is a race to develop a vaccine worldwide, which would help those of us who haven't gotten infected from the virus, so hopefully we can start to build immunity to it. And that would also help us to return towards normal life because as more and more people get the vaccine, we suspect that more people will build immunity to SARS CoV 2. The process of producing a vaccine is typically long and complex because we need to ensure that it works effectively and that it's completely safe. This requires many, many rounds of tests, which can often take 10 to 15 years. The fastest vaccine that has been developed was for mumps in 1967, and that took 4 years to develop. Nonetheless, it's being estimated that the vaccine for SARS CoV 2 could be ready in approximately 12 to 18 months, which would be a record breaking feat. But how come we get a flu vaccine every year? When it comes to the flu, vaccines are usually changed slightly each year. We have some ingredients we can use from past years to make the new vaccine, but with the coronavirus, we're working with much less. For certain pathogens such as HIV, it's much harder to produce a vaccine. In fact, there is currently no vaccine available for HIV. Why is that? As we've discussed, the goal of a vaccine is to mimic the body's response to a pathogen. But for HIV, we know that the body is not able to eliminate the virus, so we haven't been able to come up with a vaccine that trains the immune system to get rid of it, in the way it would for other pathogens. Like we mentioned before, HIV can change quickly over the course of an infection. This makes it extremely challenging to make a vaccine that could keep up with all of these alterations. Although there's no vaccine for HIV, there are still ways to protect yourself against it and to decrease your chances of getting it. The best method of HIV prevention is being educated and informed about the way it's transmitted. This includes following safe sex practices. Since HIV is transmitted through bodily fluids, sexual intercourse is the main way in which HIV is transmitted. Condoms greatly reduce risk of HIV transmission. Another way HIV is spread is through the sharing of needles for drugs and through piercings and tattoos. There are also medications that can be taken to reduce the risk of HIV called PrEP. If you don't have HIV, taking this daily pill can decrease your chances of getting HIV from sex by about 99%. A medical professional like a nurse or doctor can help you decide if PrEP makes sense for you. There is also a medication called PEP that can be taken directly after exposure to HIV. If you think you may have been exposed, taking this medication within 3 days will lower your chances of getting infected. This is not an alternative to using condoms or taking PrEP, but it is a good thing to know if you are ever in a situation where you think you might be at risk. As I'm sure you have been hearing repeatedly, there are many measures you can take to reduce the risk of getting and spreading the coronavirus. These include staying at home whenever possible, following social distancing guidelines, coughing and sneezing in your arm or in a tissue, and washing your hands often for more than 20 seconds with soap. You can also use alcohol-based hand sanitizer if soap and water are not available. You can also use soaps and disinfectants as well to keep surfaces clean. For all diseases, prevention and treatment is the end goal. Everything we've seen so far throughout this series, from the origins and epidemiology to the molecular structure and function, the immune response and symptoms, and to screening and testing. All of these gave us information to help better understand our two viruses. With this, better prevention and more effective treatment can be developed. Around the world, decades of research go into all these aspects of diseases, including viruses. All the research and information gathered about diseases helps lead to better treatments and methods of prevention, which help millions, if not billions, of people worldwide every year. More research is needed for many diseases, including those caused by HIV and SARS CoV 2. We hope this series has been helpful in explaining some of the important aspects of these two viruses and in showing how important science is to society, especially in the domain of health. In the next few months and years, you may witness this as the world moves forward and deals with the aftermath of the COVID 19 pandemic. And who knows, in years or decades, perhaps SARS CoV 2 and HIV will be things of the past.